Here we are at the last video of day 1 of Unit 2. This is where we will start looking at actual bones and bone parts. And I will walk you through a lot of the skull on this video, even though I think the slides are mostly useful as study tools, and they're not really meant to be lecture slides. But I will walk you through a few of them just to get you started on how to think about the skull, because the skull is complicated. So, the first bones you're going to learn in this class are all from the axial skeleton. Today, the skull. Monday, it'll be the vertebrae and the ribs, I think, something like that. And then after that, we'll tackle the appendicular skeleton. So for now, the skull. The skull, look at this. Cranial bones, there are 8 of them. Facial bones, there are 14 of them. That's a lot of bones in a small area. And when you're thinking about the skull, you might think it's one giant weird bone. I don't know what you think, but I don't know. I don't think it's intuitively obvious that it's made of that many bones. What does make sense about the skull is that it is so complex. There are a lot of holes that have to be there to let nerves and blood vessels and other things through. The main job of the skull is to protect the brain, that's the cranium, and then the face has a lot of other functions. And all of those functions are pretty much reflected in the structures of the skull. So we can label the visible bones, and this is going to be kind of where you start with the skull, is get used to what are the different bones first. Once you know all the bones from whatever angle you normally look at, it's a good idea to do things like get the software, spin the bone around, spin the skull around, see it in a new angle, and then re-identify the bones. For example, the sphenoid bone is visible here as these pink structures, this complicated pink structure, and it's also visible here. But really you can see more of it when you take the top off the skull and look down from another angle. So you're going to be seeing the sphenoid bone from different angles. And in these slides we'll show you what shape it would be if you took it out of the skull. It's just going to take time and looking at it from different angles to get the hang of it and to really be able to visualize this stuff. So, yeah, these are all the bones that we can see in this view, and this view shows us most of the bones. Yeah, most of the bones. If you look down, I can't see this well because of my recording controls, but there are, 2 bones you can't see. Okay, cool. We will look separately at the cranium versus what we call the facial bones. So the cranial bones are all the bones that participate in forming the cranial cavity, and protecting the brain. The facial bones are all the other ones of the skull, and they all have a lot of different functions. Okay, so here's another diagram you can look at, and I just want to get to the individual bones. So we start with the frontal bone. This is the bone that makes the frontal area of your body, the frontal region. That's your forehead. And let's see, what can I show you? It seems silly to me to read these things off to you because they're just Latin words and they're not memorable when you see them in lecture. You really, really have to sit down and start trying to learn this stuff to remember it. So I'm just flipping through here looking for sort of tricky things. One thing that is possible with any skull model you get, the little plastic ones that I recommend buying or the big plastic ones that we use in the anatomy lab, you can take off the skull cap or calvarium. So the calvarium would be this. You can take it off and see a superior view. This view is going to show you a lot of the cranial bones. So it's good to keep coming back and looking at the different views and piecing together what you've seen. We also, if we see a sagittal view of the brain, we see all these weird structures. Well, here would be the frontal bone. And the frontal bone, it has this weird shape because it curls back around to the sides, and it forms the upper part of the orbital cavity. So this is all frontal bone in yellow here. It also has sinuses, so it has sinus spaces inside it, and those empty spaces inside this bone make the bone a little bit lighter, but also they are part of your respiratory system. So as you inhale air, some of it goes into the sinuses and gets sort of treated before it comes back out and goes down to your lungs. Let's see, so you'll just have to start studying the frontal bone. Temporal bone has a much more complex shape. Excuse me. So let's get into it. I can just turn off all these other systems, and I want to show you the temporal bone without all the other systems getting in the way. It's going to be a challenge to whatever, I don't know. Okay, so I turn off all the systems and I'm going to search for temporal bone. And it takes a second for the text to appear because it's thinking, and then I just look down, what do I see? Let's get the right temporal bone. So it's going to draw it for us. And what this allows us to do is spin it around. Spin it around. So I can temporarily put it here, and if I click this button, it will put the rest of the bones in. And then if I hit undo, it should take the rest of the bones away. Yeah, it takes the rest of the bones away. So a few structures that might jump out at you on this temporal bone. There's this hole here that is your external auditory canal, or meatus. That's what you clean when you clean out your ear. This structure here is part of your zygomatic arch. So this arch here, and when you look at different views, you'll see there is an arch that connects your cheekbone to your temporal bone back here. Your cheekbone is going to be called your zygomatic bone, and that gives the name of the first marking I'm going to show you, which is the zygomatic process. So this temporal bone has a zygomatic process, and it's named that because it reaches out towards the zygomatic bone. The zygomatic bone is going to have a temporal process that reaches towards the temporal bone. So you'll see that. There's a temporal squama, and remember what squamous tissues are. Remember the cell shape squamous. It's flat, and a squama is a flattened area, and so part of the temporal bone is kind of flat. It's a plate, and that makes up part of the lateral wall of the cranium. So if I put it here and bring back the bones, that's where that would be. I also want you to notice this structure here, this mastoid process. That's this right here, and you can find that on yourself, and that's connected to some muscles that are going to be kind of interesting to us. Let's get rid of that for a second. And there's one other major part of this bone with structures on it, and that's called the petrous portion. And that's this big thing here, this region. And the petrous portion is going to have several foramina in it. foramina is the plural of the word foramen. And I don't have my little marker thing, so you will find those words in the literature on the bones, in the stuff you're studying. You will find foramen and you'll find foramina. They refer to the same thing, but foramen is one, it's singular. Foramina is two or more, it's plural. So there are many foramina in the petrous portion of the temporal bone. And that's what I want to show you about the temporal bone. Yeah, okay, let's go back to the slides. So, some other interesting things. In the lab manual, the temporal fossa is listed as a marking of the temporal bone. The temporal fossa is bigger than a temporal bone. It's actually this whole indentation on the side of the head. And it's the location for the temporalis muscle. So, okay, so the temporal fossa is this big structure. So I'll show you the temporal fossa is visible as what's delineated by these big lines, and these are other structures you'll need to know. And it is the location of the temporalis muscle. So I'm going to turn on some muscles and show you that. When you turn on muscles, you get all these deep muscles, and here is the temporalis muscle. And this is one of your major chewing muscles. And I just want to show you the software gives you some interactive animations. So you can see what happens. You can see all the muscles that are involved in this, and then you can see this muscle glows when it contracts. So this muscle, this temporalis muscle, is located in the temporal fossa. And that's whatever, that's this big region. Okay, enough of this. Remember the petrous portion I talked about. Well, if you have this superior view of the skull, you would see the petrous portion here. And this region, this indentation here, which is the same as the indentation here, this is where the temporal lobe of the brain goes. Okay? There's more of the temporal bone. This is an inferior view of the skull with the jawbone removed, and you'll find some of the structures there. The parietal bone is not as complicated. It's this bone up here. There are two of them, and they meet in the mid-sagittal line. And what else? Let's see. So those lines that delineate the temporal fossa are the superior and inferior temporal lines, and they show up on the parietal bone. The occipital bone is much more interesting. This is the most posterior bone in the skull, and it wraps around underneath. And it has these condyles, and these are the structures that sit on top of your vertebral column. And so the weight of your head sits on these two structures, which sits on the vertebral column. Your spinal cord and part of your brainstem come down out of your brain through this foramen magnum. Foramen magnum, that's big hole is what that means. So this is all occipital bone. Brown back here is occipital. Let's back up. And I want to show you the occipital bone here. If I click on it, that's it. That's the occipital bone. And you can see it curls around under there. These are the two parietal bones I just talked about. Okay, so then probably my favorite bone of the skull, I'm not convinced, this is one of my two favorites, is the sphenoid bone. It looks like a crazy bat. And it is the most central bone of the skull. It connects to a lot of other bones. It is in a really important position. And so it has a lot of foramina moving through it. what I want you to get here are the major parts of the sphenoid bone, and it's going to be way easier if I just get rid of all the other bones. Okay, so this is the sphenoid bone. What is difficult to see here is that this is your orbital cavity. So if I bring back all the other bones, this is the sphenoid bone, and it has this slit in it. That slit is the superior orbital fissure, and that's the slit that, well, blood vessels move through that slit, and muscles. That slit is the superior orbital fissure. So here we're looking at the outside of the skull. Sphenoid bone right here. Here we see a couple different things. We have what's called the wings of the sphenoid bone. So if I click on it, I will pull up different views, and parts is what I want to do first. So we have a lesser wing, which is this what's purple up here, and we have a greater wing, which is, well, which is really all this other stuff down here. We also have pterygoid processes that reach down, and the pterygoid muscles attached to them, and they are chewing muscles. We also have what's called the sella turcica, this thing right here. I think if I click on it, it will, yeah, the sella turcica will be highlighted here. Its name has something to do with a saddle, and what this is for is your pituitary gland. Your pituitary gland sits in here. And the indentation here, where the pituitary goes, is called the hypophyseal fossa. So there's that. So that's sphenoid bone. So you can find all that stuff here. Oh, sorry. There's some other kind of intense stuff about the sphenoid bone. So the sphenoid bone includes the optic canal. That's this. This is what the optic nerve travels through to bring sensory information from your eyes to your brain. So yeah, the optic nerve travels through here. From this side, you can't see it. You have to kind of rotate like that to see the optic nerve, or the optic canal, sorry. And then you have other foramina here, and I think you can click on them. Yeah, they make them clickable, so you can figure out what they are when you're in this view. Okay, sphenoid bone, cool. Ethmoid bone is my favorite if sphenoid is not my favorite. The ethmoid bone is this super weird bone that is mostly air, and it sits directly anterior to the sphenoid bone. It has a couple different central things going on. It has the perpendicular plate that separates your nasal cavity into two halves. This is one of the two. There are two bones that work together to form this septum in your nasal cavity that separates it into a left and right part. It also has an orbital plate that forms part of the orbital cavity. It also has the crista galli and the olfactory foramina. Foramina means lots of holes. The olfactory foramina are the holes that your olfactory nerves pass through and give you your sense of smell. So everything we see right here, we're looking at the inside of the cranium. So the brain would be occupying all this space right here, and this space, and this space. But if you go through these holes, you end up in the nasal cavity. And that's the ethmoid. Facial bones are these. The maxillary bone is going to form part of your nasal cavity. The mandible is your jawbone. and it has more markings. It's bigger and it's very prominent and it moves. It's the only bone that is going to move a lot. So it has a condyle that's going to form part of a joint. It has coronoid processes where some muscles are going to attach. It has mental foramina, one on each side, which are going to permit some nerves to come out and innervate the skin of the jaw. Stuff like that. Your zygomatic bones are your cheekbones, and again they have a process that reaches back to the temporal bone. The vomer is this tricky one. This forms the bottom part of the nasal septum that separates your nasal cavity into two halves. Now, this is kind of a weird view. They're trying to show you that they just took a fairly thin section of this. If I bring back the rest of the bones, I can find the vomer right here, and then hide everybody else. That's the vomer that makes part of your nasal septum. We can bring everybody back. One thing you'll do once you have this software is you'll use the phase or the fade function, so you can fade all the other bones and get a better sense of where this one is. Yeah, it's making part of the nasal septum. The superior part of the nasal septum is the ethmoid bone, and it's much more complicated than the vomer. The bone that you have the most difficulty seeing or finding is the palatine bone. It forms part of your bony palate here. And again, this is best found in the software. So one thing I can do is go to model and just do head and neck, and that will get rid of a lot of the other stuff that would be in our way. And our palatine bone forms the posterior part of the palate, and it is a pair of bones. And where is it? So I highlighted it. Where is it? Well, if we fade everybody else, we can see this palatine bone and its shape. So there's a palatine bone. Yeah, there are some other little bones up here. Your nasal bones form the root of your nose. Your lacrimal bones have a canal that connects your orbital cavity to your nasal cavity, and that's where your tears go normally. When they wash the front of your eye, they go through the lacrimal bone to the nasal cavity. You also have nasal conchae. These are important structures for the respiratory system, and they're bone parts that stick out into the nasal cavity. And there are other structures to learn. This is a super cool, this is a frontal section through part of the skull. You're also going to learn the orbits. A good question I can ask on the exam is name all the bones that are part of the orbital cavity. There are 7 of them. And it's just good to go through this kind of exercise because you keep finding these bones in different places and you get a sense of their structure and where they go in the skull, and every time you do that you get a better sense of the skull. So I do recommend challenging yourself with this. The foramina are going to be tricky at times. So you really will benefit from watching a video or using the anatomy software. This is showing the parts of the skull where the brain goes in the cranium, and then this shows your hyoid bone that sits kind of just behind your mandible, and it acts as a base for the muscles of the tongue and the larynx in your throat. And then we have these bones The auditory bones, we will cover these when we learn about the ear, so we'll skip these for now, and we'll skip the teeth for now. And then the last things I want to point out are the sagittal, or the superior sagittal sinus, and the other dural venous sinuses. These are how blood gets out of your brain. So blood gets pumped to your brain through two sets of arteries, and it all gets collected in these sinuses, and they all drain through the internal jugular vein here. So you'll find grooves for those sinuses on some of these bones. Okay, so what those grooves are for is these blood vessels. Okay, that's enough for now. That is enough of the skull. I realize these long videos are annoying, and I will work to make them shorter in the future. But good job hanging in there and staying with us. So good luck studying, and keep in touch.